Show that patients who are actively involved in their care do better and feel better.
That's because these patients may ultimately get better care and take better care of themselves in the process. In this edition of Deanna's Discoveries, she explains how and why she chose her radiation treatment plan.
After a great deal of research, I decided on a complicated radiation regimen only available at a couple of cancer centers in the country. The research was hard. The decision was harder. But after facing the big C 4 times, I've learned I have to work for my wellness.
It's week 5 of my daily radiation treatments at MD Anderson Cancer Center in Houston, Texas.
So this is the electron beam.
And my radiologist is checking my skin.
You've got some radiotherapy changes in the central chest area.
I have radiation dermatitis, temporary skin reactions to radiation therapy.
While it looks bad to the eye, I don't have patients who are in pain.
Instead, it itches. That's certainly true in my case. Hopefully, it's the only side effect of this complex radiation treatment for my advanced breast cancer.
You had some disease in the lymph nodes that were next to the breastbone, so I had to get dosed there. The heart is directly below that, just a couple centimeters away.
So my radiologist created a specialized plan that targeted the tumor beneath my left breast, lymph nodes beneath my breastbone, as well as microscopic cells that could be lurking in my neck and armpit, all while avoiding my heart and lungs. Every time I come for radiation here at MD Anderson in Houston, I bring a little bit of home with me. This is a radiation cape made for me by another survivor at the Breast Cancer Coalition of Rochester. It's time to get started. Come on back.
Do you feel like so you're in the cradle?
Radiation therapy technicians carefully check my position, assuring that I'm perfectly aligned. Now this is where my work begins.
Take a breath in and hold.
The monitor on my stomach allows me to gauge how deeply to inhale, and when the yellow line is in the blue area, the radiation begins. It's called deep inspiration breath hold.
The breath hold allows your heart to pull away from the area that we're interested in.
And that protects the heart from radiation exposure. The technique is used with patients like me who have breast cancer on the left side.
Breathe.
And they use electrons above my breastbone, beams that don't penetrate as deeply as X-ray beams, minimizing exposure to my heart and lungs. And that's really important, especially in my case. I've had cancer 4 times. Clearly, I have a propensity for developing the disease, and some types of radiation treatment can expose healthy tissue, causing a new cancer years later.
We're worried about second malignancies, lung cancers, breast cancers.
So I did a great deal of research to find a specialized treatment approach to my advanced breast cancer.
I expect you to be cured, and I don't expect to have caused you any increased risk for second malignancies in the decades that are to come for you.
After all, I have a lot to live for.
When making your own treatment choices, have an honest discussion with a medical team you trust. Don't be afraid to get a second opinion. And on our website, I provide a number and a link to a great service free to cancer patients. You're matched with a specialist who will help you explore all your options. It's your life, your health, and ultimately, treatment is your choice. Deanna Dewberry, News 10 NBC.
And Deanna has done a series of stories on cancer, everything from chemo to financial concerns. You can find them at WHEC.com. Just click on Deanna's Discoveries.
As most of you know, I was off the air for weeks while I got radiation treatment in Houston, and while there, I met a patient from Pennsylvania who grew up right here in upstate New York. Her story is so important, I knew I had to share it with you.
Celestial sounds fill the high-rise apartment she's called home for months. This is Elsie Spry's sanctuary, her place of peace during treatments in Houston for advanced breast cancer. It was a diagnosis she never expected.
I was just shocked because I thought, dotted my I's and crossed my T's.
After all, Elsie had taken every precaution, and with good reason. She was in her late 20s when her mother died of the disease, so Elsie had always been vigilant.
No sugar, high protein, lots of veggies, exercise.
And annual mammograms from the age of 31. When she was 48, she felt a change in her right breast.
Describe for me what you felt.
A thickening.
She told her doctor that something was wrong, but for 12 years her doctors insisted her mammograms were normal.
Year after year, they told you what?
Healthy tissue.
And you believed them.
I did.
What reason would you have not to?
None.
What Elsie didn't know is that mammograms often cannot see the second most common type of breast cancer, invasive lobular carcinoma.
About 85 to 90% of breast cancers are ductal, like mine. This is imaging of my breast cancer, and you can see that the cells form a dense lump that really lights up on imaging. But in 10 to 15% of breast cancers, they're lobular. They don't form a lump. Instead, the cells spread out single file along the tissue plane.
So you don't have an area of distortion, you don't have a dense mass, and it can be completely invisible on a mammogram.
This isn't just me. This is 40,000 women in the U.S. alone this year.
Women like Elsie who have breast cancer even though their mammograms appear normal.
Just getting that information out.
Because had she known, she would have pushed for an ultrasound or MRI, more effective tools for diagnosing lobular breast cancer.
It really does speak to the importance of patient education.
Holly Anderson is the executive director of the Breast Cancer Coalition of Rochester. So what's the solution?
I honestly think knowledge about your own body and persistence in getting answers.
So she's at her halfway point?
And renowned radiologist Dr. Eric Strom of Houston's MD Anderson Cancer Center says doctors must listen and address that persistent patient's concerns.
Because you're worried about it, let's take a sample of that and make sure, let's get the right imaging. But we need an answer rather than, I don't see anything.
Unfortunately, Elsie's doctors didn't see anything as her cancer spread. She believes it's the medical community's responsibility to empower patients with information about lobular cancer.
Just inform us, then we can make our choices.
Elsie is fighting to make periodic breast MRIs standard breast screening in her home state of Pennsylvania. But radiologists and cancer advocates I spoke to don't think that's the solution. They do believe that patient and physician awareness is key. Remember, breast cancer isn't always a lump. If you feel a change in your breast, a thickening, talk to your doctor and keep talking until he or she listens. Deanna Dewberry, News 10 NBC.
It's National Mammography Day, and there's little doubt that mammograms save lives because they allow us to catch breast cancer when it's very small.
But for a decade, there's been enormous controversy around when to start screening. In today's Deanna's Discoveries, I went to Elizabeth Wendy Breast Care for the answers.
But she also has this little area that looks irregular next to the cyst.
Dr. Stamatia Distunis, a radiologist at Elizabeth Wendy Breast Care, shows me a 3D mammogram where a tiny tumor is hidden behind a fluid-filled cyst.
See this? This is a cancer hiding under a cyst.
Dr. Distunis caught this cancer at stage 1 because this patient came in for annual mammograms. But the question that has plagued women for decades is, when should mammograms start? Routine mammography began in the 80s, and early studies showed dramatic results.
Women that start getting screened by the time they're 40, there's a mortality reduction by as much as 40%.
Your breast cancer risk increases with age. So in 2009, a government group called the U.S. Preventative Task Force recommended starting mammograms at age 50. That recommendation was met with widespread criticism from cancer patients, advocates, oncologists, and radiologists like Dr. Distunis.
20% or more of the breast cancers we find every year are in women in their 40s.
So the American College of Radiology, as well as the Society for Breast Imaging, recommend that women of average risk begin annual mammograms at age 40.
So we go by the premise that the smaller it is, the less the chance that it'll be a big problem for the woman later on.
And remember, these are guidelines for women of average risk. If you have a family history of breast or ovarian cancer, you should talk to your doctor about screening earlier. And New York law mandates your insurer pay for it. Now, tomorrow, Elizabeth Wendy is offering free screenings for uninsured women. And Rochester Regional Health is having its Mammos and Makeovers event, where they offer a free makeover, mocktails, a chair massage, and hors d'oeuvres following your mammogram. That just makes me smile. For information on both, look for web links on our website, WHEC.com. The number of measles cases in this country has hit a 25-year high, with the most cases reported right here in New York State. And when you're a cancer patient with a compromised immune system, those numbers can make you pretty nervous. In today's edition of Deanna's Discoveries, I take a look at whether cancer patients and others with compromised immune systems should consider getting vaccinated.
I'm just going to check for blood return.
As chemo kills the cancer, it kills healthy cells too, cells that support your immune system. So the current measles outbreak poses a real threat to me and others undergoing cancer treatment.
If you are already battling with a serious illness and your immune system may be somewhat compromised either from the illness or the treatment, your risk of having a more serious case of measles is increased.
Dr. Paul Grayman is an infectious disease specialist at the University of Rochester Medical Center. He says a serious case of measles can lead to encephalitis, permanent disability, even death. And I, like so many middle-aged cancer patients, don't have access to my childhood vaccination records. I was likely vaccinated in the late 60s.
During the 1960s, before 1968, some people would have received a vaccine that was not very effective.
That's because from 1963 to 1967, almost 1 million Americans were given a vaccine with killed virus. That vaccine did not work. So in 1968, the CDC mandated that Americans get an effective vaccine with live virus. I was likely vaccinated when I was about 12 months old, around 1969, but I can't be sure. My oncologist, Dr. Alyssa Houston, says current guidelines indicate I'm at high risk.
Not only is it looking at your previous history and some of your previous treatments years ago, but it's also related to what you do on a general basis, your interaction with people, your exposure risk.
So I want a measles vaccination, but I can't get one.
You have to wait at least 3 months after finishing chemotherapy based upon, again, national published guidelines.
But there is another option for cancer patients who, like me, are in active treatment but unsure about your measles immunity.
You can have a blood test which will show whether or not you are immune to the measles and can answer the question quite definitively.
It's a blood test that measures whether you have measles antibodies, making you immune to the virus. That test is first on my to-do list.
Yeah, first on my to-do list. So, your next question probably is that test covered by insurance? So, I called my insurer, United Healthcare, and my plan covers 100% of the cost. So first, talk to your doctor about his or her recommendations for you. Then call your insurer to see if the vaccine or the measles antibody test is covered. You'll need the billing codes. I have that information for you on our website, whec.com.